Dr. Dorai, the head of Oncology Department in Zahra Hospital. And it is today, we are in the October, which is the month of breast cancer awareness. So we welcome you here, all the Zahra Talk team, me and the people around us and behind the cameras. And tell me something good about breast cancer.
Dr. Nazim, thank you for the invitation. It's a very important topic, and we are discussing this in a very important month, the Breast Cancer Awareness Month. Breast cancer, the most commonest type of cancer in the women, and of course, it's a cancer that can kill people. Becoming more significant now because we are seeing more patients at a very younger age. So it's a very important topic to discuss.
But I want you to tell me something good, doctor. Not to tell me that it is a dangerous disease. I know it's a dangerous. But what is the new thing that makes this cancer, for example, under control? We are really curing patients. We are doing programs, screening programs, which are really detecting the cases early and the outcome is good or not or whatever. Just give me something good, doctor.
So the good things about, so I give you a background of why breast cancer awareness is important, because it's a very common cancer and we need to address it. And it's also a cancer where early detection will save life. So it's very important that we concentrate on this cancer, which is, big numbers, by screening programs. And we recommend a screening program for a majority of the women, and I'll go into the details of who is the right people. But also this particular month is celebrated for screening of breast cancer specifically. So what we tend to do is offer a screening which involves a mammogram, an ultrasound, apart from a clinical examination and a consultation from a specialist or a breast surgeon themselves. And by doing that, we are finding the cancer as early as possible. And of course, if we can find something early, we manage the patient and give them a chance to completely cure the cancer. So that's the intention of this month, create more awareness among people and give them the facility at a very complimentary rate.
Can you just name what are the most popular investigations we do in screening?
Yes. So we tend to say a specialist, specifically a breast surgeon or an oncologist like myself, see them so they know what to do. The history from the patient is very important, and let's hope that they're coming for screening, that they're coming walking in without any symptoms. So once they've seen a specialist, they have a clinical examination, and then they're asked to do an ultrasound scan of the breast.
Is there a specific ultrasound, or, can we do this ultrasound with any radiologist, or we should have a specific radiologist?
Absolutely, and and we in Al Zahra have we have a breast radiologist, and I think it's like any cases, people who are specially trained for these, they can pick up things even better than any general radiologist. So we recommend seeing a breast radiologist for ultrasound scan, and the same person will also be able to do a mammogram in most of the situations when these two tests complement each other. So sometimes you miss things on an ultrasound, sometimes you mix things on a mammogram. If you mix together, that you have a better chance of finding out something.
Why we do sometimes, there are areas or something, we prefer to do ultrasound, and there are things we should go for mammogram, or is the mammogram is all the time better?
No, I think that, of course, because of the exposure of radiation, mammogram has radiation, ultrasound is, of course, non-invasive, non-radiation, so that's recommended for any age group. Mammogram, we stick to a certain age group. With regards to a generalized international screening, we like to say anything age 40 or over is when we recommend somebody for a mammogram. So we start off with an ultrasound scan for a screening purpose if they're less than 40, and by chance we say something is not right, then we recommend them to have a mammogram.
What if the patient above 40?
Above 40, we actually recommend them both ultrasound and mammogram.
Because I think mammogram is not the specific investigation in young girls or young females, because the breast tissue is dense and it is difficult for mammogram to detect things, and ultrasound is
good. In fact, if you're talking about the dense breast, the best investigation is an MRI of the breast. We tend to offer them an MRI of the breast with contrast. That gives an even better picture than an ultrasound scan. Whenever there is a dense breast, we actually say the best investigation MRI scan of the breast. I also have to talk about a potential person who has a very strong family history of breast cancer. In those people, we bring forward the screening. We can even do it from the age 30 onwards. And those people, like somebody who had a strong family history of breast cancer, they are recommended to have MRI of the breast ideally. and the more denser the tissue, MRI is going to pick it up earlier. So, of course, we don't want to expose them to radiation on a regular basis, which is mammogram, but ultrasound and MRI is safe.
So I want to just to highlight one thing, which is, see, I am, for example, I'm a female patient, and I want to do one single, I don't want to be for three things. Just tell me one of them, if I want to choose between ultrasound, mammogram, MRI, and I want to finish it. What I will go for?
I think if it's a dense breast, MRI would be the recommendation. Okay, if you want only one single test and you want to have a comprehensive information on that test, I think MRI breast with the contrast would be the best if it's a dense breast. If it's not, then even ultrasound can pick up most of the things. But I wouldn't recommend one test, actually. So there isn't a single test that can rule out everything.
So can people go direct to the radiology and ask for investigation? Okay, I want to do, they can go to the reception and ask, I want to do ultrasound, I want to do a mammogram, I want to do MRI for my breast. I don't want to see the, you know, sometimes the patient came to our clinic as a surgeon, they said, I don't want to be examined, for example.
I understand, I think people can do, and that maybe there are some facilities which is offering that also, but I think we strongly recommend, and as a person who's been dealing with this for more than 20 years, we strongly recommend you see a clinician, because I think a suspicion from an expert hands is more important than an investigation, and then it adds value for the person who's doing ultrasound scan to say what it feels, and then, you know, every information helps. So I think history, then examination by an expert, then the radiology. All three together is what is recommended.
Is there a blood test we can do that can detect breast cancer or...
Let's say we are talking about an early cancer here, and there is that means they will not show anything in a CBC, complete blood counts, or a liver function or renal function. But there are cancer markers, and we do some tumor markers, we call it. We can always suggest a tumor markers. Now, the tumor markers doesn't always go up, and also it's not very specific for breast cancer. But if it is in doubt, and we can always do a very simple blood test, a cancer marker, we call it CA15-3. If it is really high, then actually we have some suspicion to investigate further.
You're always serious guy because you're dealing with cancer cases, or you are hardly smile here. In the clinic I see you smiling, but here no way.
I think the topic is quite serious here, and I don't want to give an impression that it is very light. Don't take it very light. I think it's a serious topic, and it's a serious steps that you need to take. Okay, I'm happy to talk over the coffee, and we can have a little easy chat. But
what I have the impression that breast cancer is much better than many other cancers.
Certainly, I think that's also because women walk in to be examined, and it presents something with a lump or a discharge or something. So at least patients are symptomatic most of the time, and we can pick it up early, unlike other cancers which we don't even know until it spreads.
See, the guys are asking me to close, but there is one important question. Sure. We will have another talk about it, which is plastic surgery and breast cancer. Do you think that every patient who wants to go to a plastic surgery, like implants or augmentation or whatever, they should do check-up for breast cancer before or no?
Yeah, very important topic, and like you said, we can have a detailed talk on about it. But my preliminary thing is get your clearance first. You do all this screening investigation first before you consider an implant, because it becomes more complicated after an implant to do an ultrasound scan or a mammogram and your MRI, and it's not easy to interpret. So at least get a clearance at that stage, do an ultrasound, do a mammogram, get an expert to say you're okay, then proceed with your plastic surgery.
So promise me that you will have two other talks. The first one is about the breast cancer and the plastic surgery of the breast. The other topic, which is very important, which is related to all the cancers, which is palliative surgery, palliative medicine. Okay? So we have two promises, right?
Absolutely. I'm more than happy to be here.
Thank you so much.
Thank you very much for
this light talk, and we will have you again and again. Dr. Dorai, the head of the oncology department in Zahra Hospital.
Thank you very much, Dr. Nazim, and thank you for the sponsor.